to the, I think, third quarterly meeting of the Healthcare Industry Consortium of 2024. We're going to get started. It's 1:02. If you haven't grabbed a lunch, there are lunches in the back, and I know a couple folks are going to be trickling in a little later. But before we do introductions and dive into the agenda, Ronan, I know we have some folks online. So Ronan, do you have some words of wisdom for our online folks?
Yeah, so just a bit of housekeeping. Again, this is primarily for our Zoom attendees, consortium members attending online. And I'm going to give you all audio permissions. Something to keep in mind is that we in this room will be able to hear you, but we will not be able to see you. So I apologize in advance for that, but there's nothing we can really do about it if we want to have these presentation slides up. So while I am going to give you audio permissions, all I ask is that if you wish to make a comment or question, either ping me in the chat or use the raise hand function so as not to interrupt those who are asking questions, comments, or presenting in person. I think that's it. Thank you.
Thanks, Brennan. So we're going to go ahead. Yeah, it's the slider. And get started. I'm going to go into introductions here in a second. But we have some folks joining online, and I hope everyone's staying healthy because I think the sickness is hitting folks. So we have folks joining us online today. But a little bit of overview of our agenda is, again, if you haven't grabbed lunch, there's lunch in the back. We're going to be wrapping up. In our last meeting, we went through the charter, but we're going to be wrapping up some of that. There was some great feedback on the charter, and so I wanted to go over that and formally adopt. So I'm really excited to take the draft off and turn it into a PDF and have it online. But I'm going to walk you through some of the changes around membership and alternates that we talked about, and voting that we talked about last time. And then we're going right into a discussion around advancing our medium-term objectives. Launching some work around nursing demand planning, talking a little bit about behavioral health next steps, and then we'll take a break, go through some legislative updates and looking ahead to 25-27, continuing our discussion from last time, but you'll hear a little more about two relevant policy option packages that are in the works, and then we'll go into breakout groups and have a full group discussion and maybe get out of here a little early, or maybe not, because I think we have a packed agenda. So I'm going to go around the room and do introductions. We're going to do the room first, and then the folks that are members online to do introductions, and then hand it to the executive leadership team to do any comments that they want to make. So hi, everyone. I'm Sarah Foster. I'm the Healthcare Industry Consortium policy analyst, and happy to be here.
Hello, everyone. Brian Beringer. I'm the exec at the Oregon Medical Association. Also very happy to be here.
Hi, thank you. I'm Heather Ray. I'm a stand-in for Heather Jeffress from the Oregon Council for Behavioral Health. She's at the Latino Coalition Conference in Madras. So I'm happy to be here, and I hope I do a good job representing. Thanks.
I'm Robin Moody, Executive Director of All Smiles Community Oral Health. It's a consortium of dental health plans and providers providing no-cost preventive oral health services in 300 Portland area schools.
Hi, everyone. I'm Rob Winningham. I'm a professor at Western Oregon University. Also serves as our college dean, our provost, vice president, and I've had a chance to start a couple of healthcare programs at Western.
Hi, Neelam Gupta, Director of Clinical Supports, Integration, and Workforce at the Oregon Health Authority. And I'm also very happy to be here.
Hi, everyone. I'm Gianna Bitton. I'm the Executive Director of the Oregon Center for Nursing. And we are a nonprofit organization that looks at the nursing workforce in the state of Oregon. I, too, am happy to be here.
Hello, everyone. I'm Advik Kohler. I'm the Senior Director for Pipeline Development and Operational Excellence. Gotta shorten that. Really, it's just workforce development for Kaiser Permanente. So working on all of our different student pathways along with internal development too.
Janet, Oregon Health Leadership. Thank you for feeding us. That makes me very happy to be here. I think we have a great agenda. Looking forward to the discussion.
Adrian Bennings, and I too am just so joyous and happy today. I guess there's a theme here. We're all happy today. And thank you for the food. I was so hungry. And I appreciate you all taking the time to be a part of this great initiative and partnership.
Becky Holtberg, President and CEO of the Hospital Association of Oregon. And I guess I think I'm feeling peer pressured into things that I'm happy to be here.
Happy to be here. Dave Kohler, Rogue Community College Student Instruction for Health and Public Service. Thanks.
Good afternoon, Duncan Wise, Oregon Business Council. I am always excited to be at these meetings. We are very involved in all the consortium building, and it's been really exciting to watch the progress of this group.
Kathy Reynolds, VP Talent Management. People are on this. Like this is all pipeline stuff. Plus moving people around. Happy to be here.
Good afternoon, everybody. I'm Liz Rain. I'm over at Oregon Department of Education. I represent career and technical education at the high school level, so I support students going into healthcare programs. And I am also happy to be here because I'm not in my cubicle over at the state capitol. Thank you for having me.
I'm glad I started the happy to be here. We can use other language like enthusiastic, eager, to know other adjectives, but I'm going to have folks coming in quickly introduce themselves.
Hi, everyone. Rachel Curran Henry, she, her, hers. I'm with Governor Kotek. I serve on the Health and Human Services team. Thanks.
Thanks, Rachel.
Hi, I'm Melissa Unger, and I'm with SEIU Local 503, and I'm happy to be here. So I'm a little late.
Wonderful. I'm going to have the folks back there and introduce themselves. Emily's making her way to the table, but getting my steps in.
Hi, Ellie Boggs with OHSU Government Relations.
Hi, everyone. I'm thrilled to be here. This is my first in-person Teacher Ready meeting. I'm Denise Stallman, Assistant Vice Provost for Workforce Capacity Development for OHSU.
Hi, everyone. Rick Allgaier from the Oregon Center for Nursing Research Director, and I'm ecstatic to be here.
Additional adjectives. Welcome. I'm going to hand the microphone to you. We're just doing quick introductions before we dive into our agenda. Are you ready for your introduction?
Hi, everybody. I'm Phil Bentley with the Oregon Healthcare Association. Anything else I'm supposed to add? Cool.
You're happy.
I'll go grab lunch then.
And one more, I think.
Hi, everybody. I'm Emily Henke, CEO, Oregon Public Health Institute. Also happy to be here.
Awesome. So we're going to move into approving the meeting minutes. Can you advance? Actually, can we go to the online? I forgot we had folks online to do introductions. So can we go to the folks online?
We'll start with Marin.
Hi, can people hear me? Yeah. Great, thank you. I apologize for not being there in person. I have like meetings from 1 o'clock to 7 o'clock today. But again, Marin Arriola with the Governor's Racial Justice Council, Chair of the Health, Equity, and Human Services Committee, and also representing CBOs with Consortium, and also with Advanced Economic Solutions. Thank you.
Okay, I'm going to go down the list. Melanie Olson.
Hi, everyone. Melanie Olson, representing Business Oregon.
And Cheryl.
Hello, Cheryl Cohen, Healthcare Workforce Strategist with Pacific Source.
And Chris.
Hi, Chris DeMars, she, her pronouns. I'm the Director of the Delivery System Innovation Office at the Oregon Health Authority.
And Heather.
Hi, all. Heather Stafford. I currently serve as Executive Director of the Rogue Workforce Partnership, and I'm here representing the 9 workforce investment boards and Oregon Workforce Partnership.
Thank you. Now I'm going to hand it over to our executive leadership team, who's already done introductions, but to lead the approval of the meeting minutes section of our agenda. Does someone want to? Would you like?
No. I think I can do this because I like let other people eat. I am leading. We have meeting minutes from April 2nd in your packet. Thank you to the staff for putting them together. And I need approval of these meeting minutes. Yeah. Okay, I need a motion to approve these meeting minutes. Do we have a motion? There's a motion. Is there a second? There's a second. There's a motion and a second to approve the meeting minutes. Are there any objections to approving the meeting minutes? Hearing no objections, the meeting minutes are approved.
Appreciate that, Melissa. Sensitive microphone. So now I'm going to move into the public comment portion of our agenda. Do we have any public comment? Okay. Now we will move in to the adoption of our charter. So I just wanted to bring us back to the discussion from April, where we went through the different components of the charter and had a discussion in particular around membership and membership terms. We had a discussion around sending alternates. We had a discussion around meeting accessibility and voting and the consensus process. And all of that, I took that feedback and incorporated that language into the charter that you have in your folder. So I'm going to walk through some of the changes and we're going to vote to adopt the charter and hopefully take the draft off and it will be our formal document. So can you advance the slide, please? So I'll walk through the changes that were made. So for membership terms, what engaged membership looks like and we discussed engaged membership being essential to ensuring equitable participation in decision making. We also talked about membership in good standing and what that means, and that requires attendance at a minimum of 3 meetings per year. Attendance at in-person meetings is preferred. The virtual attendance is an option for members under extenuating circumstances. I know we had members that were sick today, and we certainly don't want to bring that into that space, into this space. And so while we won't be running hybrid meetings, we will have the option to have or have virtual attendance under these extenuating circumstances. We are also going to be hosting one meeting fully on Zoom during the winter months, knowing that travel is challenging, and one meeting elsewhere. We know people are traveling from other parts of the state, and so we will be going to another part of the state for one meeting, and then the other 2 meetings will be in probably at OIT or in this region. So for alternates, the purpose of sending an alternate is to ensure continuity of representation in these extenuating circumstances. Because I know folks have conflicts or are unable to attend, as I know Heather had mentioned that she is going to be at a different conference, and we understand that. But that the alternate, if they are going to come, should be representing that voting member, not replacing them. And members and their alternates are both invited to attend and participate at Consortia meetings, so there's continuity of the conversation, but only voting members will participate in the action items, unless the alternate is attending under extenuating circumstance and can vote on behalf of the member. And these are all in your charter. They're the underlying portion in your charter. And then I mentioned this before, so we're going to be doing 3 quarterly meetings in person and 1 quarterly meeting in the winter will be held virtually. And where in-person attendance is requested, the HEC may be able to reimburse consortium members to travel. Next. And then a quorum must be present for consensus process and majority vote. A quorum will be achieved when a simple majority of the voting membership is present in person or virtual. So that was a discussion last person, and so the quorum is, and when we are deciding on that action item, which we will be in 1 minute, that a quorum does have to be present in person or virtual. There was some questions around if people can kind of quote mail in their vote earlier, but public meeting rules say that folks do have to be present at that time. So that was it. We had a lengthy discussion on the charter, but wanted to kind of tie a little bow on it. Does anyone have any questions before we move to, and I do not have red, yellow, and green cards, so we're going to have to use, it's been a morning. We're hands. They might be in the back of my car in my trunk somewhere down the road. But so do anyone have any questions on the revised language in the charter before we motion to formally adopt it? Great. Does someone in my executive leadership team want to move through the?
Looks like we're going to get this across the finish line. So is there a motion to approve the revised charter as presented?
So moved.
Okay, we got to move and second. We have a move. Any discussion, any objections? All right, so it looks like it passes, and great job on taking the feedback and capturing all of our thoughts in this. Thank you so much, Sarah.
I had a feeling we were going to be moving quickly through that first part of the agenda, but I know we have a robust discussion ahead on our medium-term objectives. All right, so I have a couple of executive leadership team members that are going to help me move through this process, Becky and Melissa, but I just want to take us back to April and even maybe into January, but if I can even remember what happened that many months ago. But our first objective as a consortia was to formally advise on future rounds of workforce readiness funding. And that I think was a process that helped build our collaborative muscle to get into some of these bigger issues that we want to tackle as a consortia. And in January, we moved those recommendations forward, and that RFP now that culminated in those recommendations is live. And hopefully y'all are promoting that RFP, and it was in 2 areas, RFA. It was in 2 areas, the nursing career pathway and community identified workforce. So that was a heavy lift, I think. And in April, we celebrated that, and we went through the charter and we started to talk about, okay, now that we're moving into our medium-term objective space, which is the next slide, Ronan. It's through December 2025. And in our charter, it outlines 3 objectives, which are very broad. You can go back. The first is to make strategic policy and funding recommendations to address healthcare workforce gaps and opportunities. Second is to establish standing working group structure. And the third is to establish success measures. And as I reflect on these very big objectives for a very big healthcare ecosystem, there were some comments around how do we not boil the ocean? How do we get some tangible things done? And in an adaptive, dynamic environment that the healthcare workforce system is right now. Things are moving quickly. Lots of organizations are in, I would say, crisis, but how can we address some of these crisis issues, but also think long-term? Think, how do we build an equitable workforce system long-term? So I've been thinking about how it can feel daunting to think about how to tackle the entire healthcare workforce system. And so I think that I just want to say that we're doing it. Each meeting we're learning, we're planning. As you saw, we planned with the funding working group, and we started to elevate some emerging priorities out of that work. And then we're going to act. We acted by recommending there are 2 focus areas of the RFP, but we're not going to wait for a perfect process. And I kept hearing that from y'all. It's like, we can't wait for a fully baked strategic plan. We have to act on some emerging priorities, knowing that we're not going to be perfect. But I think that this is something good to keep in mind as we do start to pick priorities and start to move and advance objectives, is that we can't wait for a perfect plan. We can't wait for hearing from every single industry partner in the state. We know we have some immediate needs that we need to act on. So this is our process for priority setting, and we are already starting to do that. Next slide. So I'm going to go through quickly before we get into a discussion and feedback from consortium members on really where our emerging priorities sit, in particular around some work group work that we're going to launch and some engagement with the behavioral health workforce. Next slide. So when you think about what we've been learning as a consortia, we learned over the course of 6 months what the funding ecosystem looked like. Like where have we been funding efforts? What do the supply and the demand data say? What are the highest priorities? What are communities saying? What are the regional nuances and differences? And all of that culminated in our recommendations for our funding working group, which were twofold. One, around the nursing career pathway. I think we heard several presentations around the nursing career pathway and nursing planning. And the funding working group elevated that as, hey, this is really important, and no one's really stepping into this space to either fund these pathways in a meaningful way. So we chose that. We also talked about the nuance in community. We had several funding working group members say, hey, you know, like nursing is okay, but we need surgical techs or we need, we need behavioral health workforce. We need community health workers. And so the second priority that we picked as a funding working group was communities identifying their workforce needs. However, I'd say that there's been a robust discussion in our funding working group around behavioral health as an emerging priority. I think the funding working group at the time said, well, that can be under the community identified needs, but we want to learn more. We want to understand what occupations along the occupation continuum are the most need. What are, like, where can we really start to prioritize, and what value can this group have in the behavioral health workforce? So now we're planning. Informed by data, I'd say that we continue to look at the integration of supply and demand data. Our principles are to lean into emerging opportunities, and I heard that a lot in your discussions when I was looking at the notes in your breakout discussions last time, is we cannot wait for perfection. We have to start to make progress as a group. It needs to be informed by industry, and I'll give an update on the industry focus groups, but we know that we need to hear from industry partners and employers in particular across the state. And we need to think about where this group of folks in the consortium can add a unique lens and value to the issue. We know there's lots of conversations around healthcare workforce. We are not the only one. How can we connect to those conversations and add value to the work? And we talk a lot about aligning with the governor's priorities. So especially when we're thinking about informing policy and funding, like where can we uniquely align with the governor's priorities? So I'm going to call out and walk through based on what I've been hearing, what came out of the funding work we had at our last meeting, and with lots of one-on-one conversations where I think there are 4 priorities that we're going to be working through the next 6 to 9 months. Okay. And I'd say the first 2 are priorities, the second 2 are more inputs to the priorities in our process. But the first is around nursing demand planning. So heard a lot about, the need to expand education and training for nursing, but also the maldistribution of our nursing workforce. And so leaning into a conversation that not only can create a shared short, medium, long-term strategies around this, but also get 5 layers deep on what we need to do and start to set priorities from there. So that's one 2024 activity. I'd say early 2025 is launching a nursing demand planning work group. And I want to bring us back even to the launch of the consortia. We had this concept of 3 standing working groups. And what I heard from you is, hey, these are too big. Integrating supply and demand data is too big for us to think about. We should just be doing that. Integrating education and training pathways for what? To what end? And so I'd say that some of the concepts from those initial working groups will be certainly woven into this nursing demand planning working group. Like, how do we integrate the education and training pathway for nursing? How do we integrate supply and demand data, or what integration supply and demand data exists? How do we articulate that as a consortia in a short, medium, and long-term strategy? The second is around behavioral health workforce. You'll be hearing a little bit about a policy option package that the HEC developed to support the behavioral health workforce later on. But I've heard over and over again, and we know that this is one of the governor's key priorities is around behavioral health. And so the initial step is to conduct a behavioral health workforce and talent assessment to really inform 25-27 biennium investments in policy, but looking at the gaps in the existing data, the integration of supply and demand data in particular in the behavioral health space. We just don't have the same kind of level of reports and assessment that we did for the nursing workforce. So we will be, I'll talk a little bit about that in a second, but we'll be launching that assessment and we'll want your input and engagement on that. Then the third is a means to an end, but intentional employer engagement through employer focus groups, learning from Future Ready Oregon. So engaging in active learning opportunities with Future Ready Oregon grantees, and of course the ongoing data and research that comes out of our research and data shop. And I see Shoppa in the back. So I'm going to walk through these, and then we're going to have time for executive leadership team comments on it, and then open for discussion on the priorities, but wanted to go through each priority and an update on them in particular. But before I do that, just does anyone have questions on the process, the emerging priorities before I begin? Great, and I hope this is the most talking out that people get, and then we'll discuss it. Okay, so priority 1 is nursing demand planning. And so I'm just going to share the scope and what's going to come out of this work. First is really to develop a shared understanding about how the nursing demand planning issue is being framed. And I see lots of different reports out there, and I hope that we can come to a both and consensus around what we need in the short, medium, and long term. So we know we need more education and training pathways. We also know that we have a maldistribution of our nursing workforce. So can we come together and really have a clear articulation of that? And I know I've been several conversations with many of you about this, and I'm excited to kick that work off. Also getting into articulating the career lattice along the nursing continuum, and identifying scalable best practices for addressing barriers to both nursing program expansion, but also the recruitment, retention, and distribution of our nursing workforce. And then developing a set of priorities that we can all move forward. So I think that's the biggest objective, but I do think from my understanding of the issue is really getting to that articulation of the both and getting in the weeds on, as I've been talking to folks, the 5 strategies deeper on this issue. Next slide. So the deliverables are to kind of seek consensus, seek on how our Healthcare Industry Consortium wants to define short and long-term issue and opportunity. I don't think we need to spend a lot of time on defining the problem. We've defined the problem in a zillion different ways, but can we articulate how we want to solve this issue around nursing demand planning in the short and long term? An articulation of the nursing career lattice, summary of best practices, and set of priorities that can be advanced with state policy partnership. And I want to put a note on the cross-sector funding opportunities. All right, priority 2 is around the behavioral health workforce. Again, I wanted to bring us back to our funding discussion conversations around, well, a large occupation, there's so many occupations. I'm still learning about the behavioral workforce. There's QMHAs, QMHPs, the whole licensed practitioner, that master's levels. And I think that folks were like, where do we fund? How do we invest? And one of the steps that we're taking is really to conduct, and I don't know, Duncan can speak to some of the semiconductor talent assessment work, but really think about this problem from a workforce lens and in a higher ed lens. And I do not say higher ed as in just the higher ed system, but our entire education and training workforce, getting deeper into existing data and articulation of what the existing reports say. We don't need to start from scratch. There have been lots of reports that have been done on the behavioral health workforce. Might identify a set of priorities for 25-27 in the behavioral health workforce continuum. So this should inform 25-27 investments. Next slide. Thank you. So right now we're launching an RFP for a consultant to conduct this talent assessment. So no new resources needed. We, the HEC, are taking this on, but we'll want to convene a small work group as we're getting into this to just ensure we're asking the right questions, that we're not starting from scratch. I know OHA and others and OHSU have great reports on the behavioral health workforce. So how do we not duplicate that, but add value to that work and bring a refreshed workforce lens to some of it? But the assessment should be complete by December to inform 25-27 investments in policy. And then this assessment can help inform where we engage in this space and how we engage in this space. And I know everyone's been wondering maybe what, we talked about the industry focus groups at our last meeting, and we are doing these. We've had, I think we've, oh, it's on here. Thank you. We have conducted focus groups in the coastal and eastern region, and in a couple of weeks we'll be going to Central Oregon and Portland, Salem, Eugene, and Southern Oregon. We have a consultant that is actually doing the focus groups, but they've been going really well. They've been well attended, and the conversations have been really robust. And I'm even getting just emerging input, and are very aligned with our priorities, which is great. But I also think it will add additional context and value to the work as we're getting underway. And just to remind everyone, the topics explored in the focus groups are around workforce demand planning, education and training needs, diversity, equity, inclusion strategies, and retention and system barriers. So thank you to those who participated in some of the pre-assessment interviews, some folks that recommended employers, and a huge shout out to our workforce boards that have been kind of in the weeds in the different regions. I know Heather is on Zoom, but have really provided just some of our smaller employer ecosystem to participate across the state. So thank you. And then priority 4, and this is, of course, we've been learning from Future Ready Oregon along the way in the funding working group, and we also hosted, I think, Rick, you were on a panel at our September meeting, I remember, just continuing to learn from the investments underway across the state with Future Ready Oregon, but also the how-to grantees at OHA. There's lots of investments in the ecosystem, and we want to continue to learn from them, not duplicate them, but think about where our work is going to be guided moving forward. So I'll just share that we're going to host thank you, Dave, for agreeing to host our September meeting in the Rogue Valley, and also include opportunities to visit some of, if anyone attended the talent summit, which was in May, it feels like longer than that, but we had Dave and Sheila from Mercy Flights, and Kathy was on a panel just talking about, and Heather was also on the panel just talking about the great work going on in Southern Oregon. So this is an opportunity to see the work in action and host our meeting there. So with that, we're going to go into, I'm going to hand it to my executive team just to share any additional comments on these objectives, and then we'll go into just some discussion and feedback on these priorities.
There we go. I guess I would just share that I know that one of the things that's been a challenge has been actually trying to prioritize because there's so much need. And I just want to acknowledge the need and that we can't do everything all at once, but we do need to be thoughtful about how we approach the initial prioritization, and then address the gaps that we know still will exist. And I think I appreciate the work that's been done and to help us prioritize, but also again, just want to acknowledge that this is not going to fill all the gaps, and it's important to acknowledge that, and also that as we're working through this in a thoughtful, systematic process, that I think there's a commitment to address those needs as well, but we can't do it all at once. So.
Yeah, I mean, I agree with the work that's been put into this. I think the thing I'm most excited about is like, I think it does give a little sideboards to the work that we have ahead of us. And I think there's been lots of conversations that we've had as a group about, where and how do we focus, and it's too big. And I think at some point we needed a group of folks to come together and say like, okay, here's a couple of buckets. And I think this really does that. And I think it also really, I think it's honest about the need to separate out behavioral health from some of these other things, because they don't necessarily overlap as clearly as I think potentially other healthcare settings do. And so I think that will be really positive for the behavioral health workforce side, because I do think it's very different than some of the other acute and long-term care workforce pieces. And then I also just really appreciate the work that we've done on nursing to expand it from like, oh, this is about our nursing shortage to like, what does the pipeline look like to get to a nurse, and how do we think about that whole pipeline? And it's not just about putting someone in a nursing degree and then making a new nurse, but it's looking at the healthcare pipeline that then develops into nurses. And I think that's I feel like we've been trying to get there. And so it feels good to see it on paper in a more concrete way.
One of the things that there are many things that stick out to me, but one of the things that stand out align with a quote that's paraphrased that talks about we can't do this work alone. And in the deliverables, we talk about the identifying and the partnership networks, because one of the most critical things is the work that we do cannot stop once our work completes. And what it does, from my lens, is it creates something that will be sustainable and can be finessed and tweaked along the way. And so the partnerships component, linking the data within that, but also bridging the gap between higher education and workforce, and also building the talent needs with the talent assessment is going to be critical, and I think go a long way in terms of putting the state of Oregon out there as a model for how these things can work best.
Thank you. I agree with everything said. The two punctuating statements is I'm really glad to see we underlined informed by data. I just think that that's a critical component, especially when it comes to demand planning. What are the true data sources? So that will be key. And I really love that 1 and 2 I resonate with, but the employer engagement, because I think that a sense of being heard by the people who actually employ or who are struggling with workforce needs is a huge input to the discussions. But great work.
Marin.
Thank you,
Yeah.
Sarah. Just quickly, so I definitely like the priorities. I think the priorities will help in the spirit of making sure that there's more workforce diversity in healthcare. In the spirit of Future Ready Oregon, when we started creating this program back 2-3 years ago, the whole spirit was to make sure that we include the most vulnerable in BIPOC and rural communities into these industries. And I'm hoping that this priorities will do that. And that's really important to make sure that we increase the workforce diversity in healthcare. Thank you.
Thanks, executive leadership team. We are well ahead of schedule. We have plenty of time for consortia discussion on these priorities, feedback, any questions you have about where we've been, where we're landing, and where we're headed. Don't be shy.
Well, I think the priorities look great. I just wanted to, I really appreciate Dr. Benning's comments about partnerships. And I almost feel like that could be called out more some way, somehow, from a higher ed standpoint. We need partnerships. We can't figure out what the need is, right here, right now and adapt quickly enough. But also behavioral health. This is something that at Western we've tried hard to get our heads wrapped around, but you mentioned QMHA, QMHP, also the different pathways to become an LCSW and LPC and LMFT. And I'll tell you, the people that make the programs are largely the faculty. The faculty have to propose these programs, and if the faculty aren't partnering with industry, they aren't going to know what to create and how to better support that. Not to mention, the clinical times that's needed. So I really appreciate partnerships being called out.
Yes, thank you. That was great. I think future Oregon principles around incentivizing partnerships and doing things differently. And I also want to acknowledge that takes time to build those partnerships and do things differently, but that was great comments.
Yeah, I just want to ask a question, and it's not necessarily, I'm not necessarily looking for an answer today, but I think one of the things as I've gotten more involved in this space that I'm struggling with is that so much of the partnerships that happen seem to be relationship based at the local level. How do we affect state? Is there anything that we can do, or how do we create an environment where we can structure something statewide or regionally that is not so dependent on whether this person knows this person in this community? That really seems to be where some of this breaks down. And I think there's definitely a role for this body, but we've somehow got to figure out how we connect this work down to that level.
That's great. Two more comments?
These are all really good points. I was going to jump on Rob's comment. He was speaking from the higher ed perspective, and he mentioned about how faculty build these programs. And I want to bring up the perspective of the high school. Kids don't know about a lot of these careers, right? Career awareness. They don't know what LCW, I'm going to not get the acronym right, but they don't know a lot of these careers unless their parents tell them about it. They don't go into counseling unless their parent was a counselor, unless their parent was a psychiatrist. So we need to get kids aware of these careers. So we need to get industry professionals inside the doors of these classrooms to get them aware of these career pathways. So we need to build that pipeline.
Well, Robin and Becky, I think we just need to step back and think about what we're creating here. This is something at OBC, we're trying to think across all these consortia to try to, what are the principles that we're dealing with? And what you described, Becky, is the way that the world works. Individual schools go to individual employers and ask them what they need. And that's what you would expect a good school to do, and they do it. And it's really, but the problem with that is all these schools, high schools, community colleges, universities, are coming to all kinds of employers, but without any consistent message from employers about what the needs are. It's just who you happen to. Schools are doing exactly what you would expect them to do. The problem is employers aren't organized. And that's consistent across all of our sectors. We're working now really hard on semiconductor, and we've got them organized, and it's quite amazing to see. And we had a meeting this last quarter with a group of semiconductor companies and the universities and the community colleges and and community-based organizations in one conversation, 50 people in a room, and we're starting to do that. And build on the talent segment that Sarah mentioned, the mission. This work is a complete change in how we do business. We've got to just recognize that. And what's going on here, I just love what Sarah has presented and where we're going. But this is a complete sea change in the relationships. And Rob, you just hit it. And Becky, you just said it. If employers don't articulate their needs, and on behavioral health or anything else, in a way, this is what we need, here are the skill sets, here are the progressions, and then work with all of the partners to create those pathways. We're not going to get where we want to go. And to me, this group is going to have to be above the fray in the sense of looking at all the policy tools, all the budget tools, all this, the money in future is not remotely enough to do what needs to be done to fix the system. This is going to be the catalytic place where you identify what has to change in licensure, what has to change in all these different features to get the skills that the industry needs, so we have the kind of healthcare system we need. So I really think we're on the right course, but I think we've got to recognize this is going to take time. And it's going to take commitments, and we're part of it. It's a sea change. I mean, it's not just done. It's going to, if we do this right, this will be getting ever more sophisticated over the next several years.
Thanks for those comments. And I think that I'll just respond that this takes time, and I hear that, like, that's my experience too, is working in communities across the state. It's often the people that are there building those relationships. And when I've seen it come to scales, it becomes woven into the fabric of the way people are working together. And that's just kind of a standard of the way people are working together. So people change and people come in, but that's like an expectation, is that you're doing that. I think the challenge I'm seeing in this space is when you mentioned semiconductor, well, that's one specific subsector. And we have a big table here with direct care, long-term care, behavioral health. And I think our challenge is, how do you set that up at the state level with all of those different subsectors and the nuance in community? And I'm not saying it's going to be easy, but that's where I think our challenge is, hopefully getting some side rails and then making progress from there. Because as I've experienced this, it's been a year or a little bit in this role, it's felt a little, how are we going to organize the entire healthcare system? And that's not the role of this. We've got to, we've got to start small and make progress and hopefully build that muscle, collaborative muscle, so that it becomes woven into that fabric. I have a couple folks. I have Heather, Janet,
behind you than me.
One online. I saw Heather first, and then can we go to the person online?
Thank you. I know Heather Jeffries would be sitting here with her hand up, so I just wanted to acknowledge the mention about employer partnerships being so important, and educational partnerships. We totally agree. The problem in representing employers in behavioral health, the problem that we see is the departments within those agencies who are responsible for training and HR and would be the go-to contacts to partner with education and other community partnerships that want to work on workforce. They're so underwater just getting their day-to-day covered I have a feeling that's why the partnerships are so slow to come, and maybe education reaches out and it takes them a while to like find someone that they talk to, and then they find that person, and that person is present for a bit and then they leave. So just wanted to say we're really, lack of a better word, hungry for those partnerships. And I think OCBH can do a great deal to meet those needs of our organizations who can't really be there on a consistent basis. And that's something we're working towards. So just wanted to put that out there.
Thank you for that. We have someone online. Who is it?
Sure.
Cheryl, hello.
Hi. So this is Cheryl Cohen from Pacific Source, and I just wanted to make a comment around the behavioral health priority area. And I'm sorry, I'm not there in person. I'm one of those people who's not feeling well, so I thought I'd not share my germs with you all. But I'm really happy to see these priorities and appreciate how focused and time-bound they are. And for the behavioral health priority area, and specifically the behavioral health talent assessment, I really agree with the comment about ensuring that there's connection to existing work and groups and that it's not duplicative. And one of the things is around hiring a consultant to complete that talent assessment and to convene a small work group to refine the assessment goals and research questions. And if appropriate, I just wanted to volunteer to be a part of that small work group. In addition to this consortium, I'm a member of the statewide House Bill 2235 work group. And then there's 2 regional behavioral health consortiums that I'm a part of that are convened by workforce boards, the Central Oregon Behavioral Health Consortium and the Mid-Valley Behavioral Health Consortium. And both of those consortiums do a great job bringing together employers, so behavioral health and physical health providers, and education and training partners, and CCOs and other people are at their table too. But I think what both those consortiums have really shown is that education and training programs and employers, so providers, speak really different languages. And it's really helpful to kind of get them at the same table, because we want to, educate and train good providers who are well equipped to join the workforce, but also, once they're in the workforce, we want them to stay there and be happy. And I think a lot of times what we see, especially with behavioral health providers, is that they join the workforce and they're kind of surprised and ill prepared for who they serve or what the work looks like once they get there. And we want also to improve the settings where people are working, so that the behavioral health system is a healthier system for the workers who are there. So if it's appropriate, I'd love to be a part of that group. I'm also a former behavioral health provider. And I have a good understanding of some of the barriers to education and training for the workforce, with attention towards really increasing workforce diversity. So just wanted to offer some comments.
Thank you so much, Cheryl.
Yeah.
I appreciate that. Jan?
Working? There we go. I just wanted to appreciate the comment that Duncan made about this is a sea change, because I just think when I look at priority 1 and 2, I think of those as pitching, and I look at 3 as catching. We could build a pipeline and you could get career pathways out there, but to your point, are the employers ready to catch them? And are we talking the same language and expectation? And I just really would love to see 3 get more depth, and it will, because I think that the employer conversation is critical. Building this pipeline of demand without understanding what they're willing to catch, also the conditions that someone just talked about, like of retention. They're the ones who will hire and retain or not. So you could build this bolus of talent, and then the catching side is not as equipped or ready, or are we talking the same language? And I just think 3 is an absolute critical element to this conversation.
Great. Dave?
Question is about the behavioral health assessment, and whoever was on, who was it? Carol was mentioning this, and my question is, have those overarching questions been identified, or who's doing that? Is there any more information about what might occur?
That's a great question. So I'm kind of requesting a small group of folks to help me with that. We are just in the process of getting our procurement in order right now to commission the RFP for the external consultant. But what we understand in the landscape is there's and we'll go into detail around some of the policy option package components in a second. But as I look, and many of you are experts, when I look at the landscape of reports out there, there's a big, it's framed as we need, 300,000, I'm just making that up, behavioral health practitioners across the entire continuum of occupations. And I'm like, well, where and what and how, and getting a little deeper into that, and what credentials, and what are the barriers to those credentials. And there is some work. OHSU has a great study. OHA has a great behavioral health assessment study. And I think we leverage those assessments and studies and ask some specific questions related to the higher ed talent development, education, and workforce system. So we'll be to get clear on what we think we need and when, and help us refine our objectives a little more in this space. Because I can say we need workers everywhere, but I think we're wanting to get a little more surgical about that. And that's all I can answer right now, Dave. But I think that we'll look to this consortium to help provide some very clear direction around those questions. so that it's not duplicative and that it's adding value, in particular thinking about investments for 25, 27. That's why we're launching it right now. I think someone else had their hand up and I maybe, okay, great, Christina.
Hi, I'm sorry I'm not in the room with you all today. I don't know why it didn't occur to me that this was an in-person meeting. I jumped on at 1 and I was like, oh, this is not an in-person meeting. But I wanted to make a couple of comments first around the pipelines, around partnering with high schools. You know, that's one of the things that we've been doing a lot with like tribal high schools and other things like that. The other thing that we see is a really important ingredient too, and somebody else was talking about, you know, really getting kids interested in this, in these professions, is having, you know, folks from their communities who look like them in their clinics as healthcare providers. And so making sure that, you know, when they get back there, that their healthcare providers are also American Indian Alaska Natives. And we find that that's another way that we, you know, that we get our kids interested in and being clinicians, and in addition to just showing up at their high schools and partnering with them to show them how cool, you know, science and other things like that are. The other thing that you all were talking about around the partnering with employers, one of the components of our education programs is having them do so that, because we're trying to figure out how can we train healthcare providers like closer to home. And so we have them actually working in their clinics. And what we find is, while it's great, it's also really expensive for the clinics to have either, you know, their advanced practice practitioners as, you know, sort of clinical supervisors and clinical teachers for both our behavioral health staff or behavioral health students and our, you know, dental students and our physical health students. And so I think it's fantastic, but it's just super expensive. And so is there a way that we can support those employers who are providing some of the training in their clinics? Is there a way that we can support them as well?
Thanks for those comments, Christina. Do you want to I don't think you were in the initial introductions. Do you want to just introduce yourself for the group so that folks know
Sure.
who you are?
Sure. My name is Christina Freed-Peters. I'm the Tribal Community Health Provider Senior Program Director for the Northwest Portland Area Indian Health Board. And our program works to build education and training programs for community health aides, behavioral health aides, and dental health aides, as well as the regulatory and other infrastructure necessary to implement the CHAP program in Washington, Oregon, and Idaho. And we work with our 43 federally recognized tribes in Washington, Oregon, and Idaho.
Thank you so much, Christine. Janet.
Thank you. I really enjoy these priorities. And Sarah, one of the things that I've really appreciated is as you've been presenting these and everything else, you've always kind of couched it as a both and this idea of like, let's look at the holistic picture of what's happening in our workforce. One of the things that I think that we are getting from these priorities and also kind of in our minds is that if we want to make sure that we've got a solid workforce, we're going to be looking at our education partners. We're going to be looking at our schools. We're going to look at our nursing, not nursing, but all of our healthcare workforce schools. And let's also remember that when we're working on the pipeline, it's not going to, now in Oregon, all of our pipeline is going into a leaky bucket. The nurses and the healthcare workers that are working in our healthcare system right now are suffering. And and the turnover that we have of the people that are working right now is really, really high in all settings where nurses and other healthcare where other healthcare workers are practicing. So both and while we're looking at some of these education solutions, know that those are long-term solutions. And there are some short-term priorities that we could look at that are really going to be focused at how do we make sure that the healthcare systems that we are building, kind of the sea change that Duncan was talking about, if we are going to be really rethinking our healthcare systems and how we are going to make sure that the people in Oregon are taken care of when they're at their worst, when they're just as sick as they can be, we want to make sure that they're taken care of. Let's make sure that the systems that we're building are going to be designed to make sure that the people that are delivering that care are also going to be cared for.
Thank you, Jana, for that. Brendan, we have another online. Ren.
Great, thank you, Sarah. One of the things I wanted to mention is that making sure with the RFP with a consultant, and that the big part of the work is focus on cultural competency and equity in terms of doing assessment. In terms of looking at the systems, looking at the values, looking at the governance, communication, staff development, the infrastructure of organizations, or how they impact and how they deal with equity through the whole systems. And I think that's really important because it'll give us a good information in terms of how to better address or confront the issue of equity with these organizations that are trying to hire or promote or recruit diverse healthcare workers. So I want to make sure that the RFP has something about it, cultural competency, equity, and assessment as a big piece as part of the work that they will conduct. Thank you.
Yeah, that will be critical. And I think we know that in particular in the data around nursing, a lot of the entry level nursing occupations are fairly diverse, but as you walk up the career ladder, they aren't. But I understand in the behavioral health space, we have a lack of diversity across the entry to higher level positions. So certainly want to look at that in the assessment. Other comments on our, we have plenty of time, but I also know this is summer, so I'm happy that if we end the meeting a little early, but want to give us a chance to continue to discuss and provide feedback on our medium-term objectives. Okay.
Just like to focus on priority 4 a bit. And one of the big values of this, with these grants is to learn. And I'm so glad we're going to set up a presentation. That your program is amazing. Oh, sorry, your program is just amazing. But I mean, I think we should consciously, how are we going to learn from all those grants? And I think we're going to really need to think about that. I'm sort of more of a question for the group. And I don't think there's an answer right now, but we're spending a lot of money, and the whole idea is to learn from those and then figure out how to replicate them. And I don't really know how to do that. And so for example, if Rogue is doing a spectacular job down there, how do we make sure the other community colleges are aware of it and we can replicate it? And I just think we need to be thinking about that.
Yes, and I'm sure Jennifer has lots to say here too, but the way I thought about it is one, there's intentional learning that we can do just by understanding in the different subsectors of our, I know Dave is working on nursing in particular, but other there seems to be a broader learning in how we're doing things. It gets to Becky's comments around the partnerships and we're doing things differently. So maybe I think we're trying to figure out how to elevate those best practices, and not necessarily saying you must replicate X program. And I mean, I know that doesn't work. Communities are different and nuanced, but what can we learn about some of the best practices and partnerships? And I know we're learning, and I say we as in Jennifer and the grant team are learning about just equitable grant making practices and the flexible funding and some of the other outcomes that have come out of the Future Ready Oregon Year 2 report that you heard from in January. So also weaving that into future investment strategies. Other thoughts on medium-term objectives? Oh, yeah, please.
Well, this has been a great conversation. There does seem to be a common theme though, and it's related to, the idea of learning. I might even say it's a shared understanding, but I was listening to kind of identifying the problem, some of the solutions. And I mean, I think we have to do this. I really appreciated, Liz, your comment about, trying to reach the students and it's more, and if we want a more diverse workforce, we have to reach the students and the family. So there's learning and shared understanding there. We'd already mentioned, the high school and the employers, but some of the, I don't know what we call them, a regulatory body, but like MACBO, they run, the credentialing for Oregon. I hope they're at the table. It's been really hard for us to kind of connect with them, even when we're trying to do, I don't want to throw anybody under the bus here, but we're trying to start programs that would actually get more QMHAs and QMHPs. And I can't even get a call back from MACBO to get the guidance. So we need some shared understanding there, but also for HEC in the legislature. We need the shared understanding there. And I think that gets at, Becky, your question, which I've really been kind of chewing on, is how you asked the question, it's all relationship based. And then, how do we move beyond that? I think that creates some inequities. And I hope that with increased shared understanding, we can help move a little bit beyond that relationship based system that we have now.
Thank you for that. And I just do want to name, and Rachel, is that I know that in the demand planning conversation, the nursing board will be, and is really enthusiastic about being a partner in that conversation. And so I know Rachel will be part of that working group for the nursing conversation.
Sarah, I know you, thank you for all your work. One key element is, this work won't happen without excellent staff and facilitators that we all trust and listen and have processes. So Sarah, thank you for your leadership. You've been just tremendous. That's how we've gotten here over the past year. Just want to acknowledge this work and the pathway. It's been tables, right? Many different tables officially and unofficially to identify how do we help narrow where are we all hearing? Like from my seat, I hear from all of you about the challenges we have, and we have to identify where are we going to shift and have this work being built. And we heard that the industry consortia has the energy and the appetite to take this on. And we hope by having these priorities the way that they are, reflect where all of you have said we need to come together, and at least we can start that process and steps. So just tremendous work. Thank you on behalf of the governor for listening and coming together and hearing where her priorities are, but then also saying, we hear the behavioral health workforce priorities, but you know what? Guess what? The nurse planning and the demand planning and these connections we need to make is critical as well. And that needs to be on our list. And that really reflects the thought process from the consortia, also reflecting what's needed. So thank you.
Thank you for that support, Rachel.
Sorry, sir.
You're fine. I get my steps.
It's all right. Ronnie Burns with the LMA. Real quickly, I agree with everything that's been said, and I think we're focused on the right things on the medium term. I'm looking with some of the questions that Duncan and Sarah mentioned about long-term pieces. So I was looking at our plan for the long term, and I just want to make sure, and I know this has been said time and time again, but the long term is not just what we're working on today and then the next steps for it in the future. There are other pieces of the healthcare workforce that are long-term investments and take long-term work that we're not addressing right now. And I think we all would love to get to the point where we're tending the whole garden. And so I just want to make sure that that conversation has to happen as well, or we're just going to end up where we always are, where we look at one thing and we focus on it and we bring it up and then we lose other parts, and then we have to kind of go around and around. And I think some of us have been around and around a while.
So I was like, if no one is going to bring that up, I'm going to just bring it up. Yes, we are picking priorities, and that leaves sections of our healthcare system out. And I'm going to name that that's true. But as I reflect back on some of the working group concepts that we had initially as we started this work, I mean, integrating education and training pathways, when I'm like, how do you right size that? And so I'm hopeful that as we pick these priorities, one, we're going to uncover barriers that will cross into other occupation families. And I think of a lot of the entry level community health worker, CNA space, where the skill doesn't necessarily match to a specific pathway, though it's called a CNA, but if you read the talent assessment, none of the skills on the CNA match to the RN. And so they can launch to many different healthcare careers. So I hope that even as we put side rails on, some of the barriers we're uncovering can touch into the other areas, and we can serve as how are we building our muscle to work together to then work together on these other issues. But thank you for bringing that up. Other comments, questions? Well, we're going to head to a break now. I think that's a break. Yes. I can memorize it. So we're going to head to a break. I'd say come back here at 2:30. and we'll continue our discussion. That was a great conversation earlier, so just appreciated everyone's participation and feedback. Now we're gonna spend some time, go 2 slides because April doesn't have slides. On a legislative update. Before we go into the legislative update, I just want to introduce April Roman, who has been me and some other folks at the HEC as we're developing policy option packages. And as we talked about in our medium-term objectives, we're really leaning in and aligning with some of the governor's priorities around behavioral health. And April is the behavioral health advisor for Governor Kotek. So thought they could give some opening remarks before we dive into this section of the agenda. And I know April, I think joined our last meeting and introduced yourself, but here you go.
Thanks, Sarah. Yes. Hi, everyone. I'm April Roman. I use they, them pronouns, and I'm a behavioral health advisor to the Governor of Tina Kotek. I'm joining Juliana Wallace, who some of you may know, who's the Behavioral Health Initiative Director on our team of 2 to help move the governor's initiative. And as folks are probably aware, the governor started quickly with standing up 3 initiatives of her top priorities since taking office. 1 in education, 1 in housing and homelessness, and 1 on behavioral health. So I work alongside Rachel, my colleague, who has been participating along with you all for a long time on the Health and Human Services team. We work to stand up an implementation plan for some of addressing some of the behavioral health needs across the state. So I just wanted to share a little bit about some of the projects that we've identified to date and where we see this consortium playing a role in supporting some of that work. I heard a lot of great themes around from the priority number 2 on your midterm goals that feel well aligned with some of the governor's direction as well around avoiding duplication, not reinventing wheels, starting from a lot of the research that and recommendations that we've had over the years, and not losing momentum from some of the spaces such as this one. So the governor's behavioral health initiative has 3 main areas for this second year of her office. Workforce is number 1. And I'm the lead from our team on workforce. So I've been working with Sarah and Neelam and some folks in OHA around from the House Bill 2235 work as well to help identify some of those goals and workforce. Initiative number 2 under behavioral health would be expanding capacity. And initiative number 3 would be around the implementation of House Bill 4002 and on the healthcare side of those pieces. So my colleague Juliana Wallace is a point for capacity and House Bill 4002, but work together to support each other in those roles. Under the workforce initiative, we are developing an implementation plan now in collaboration with our partners at HEC and with OHA, and it's aligning initially around the budget timeline that we have in front of us, which is why Sarah invited me here to talk to you all about what we're doing so that it's clear that the POP is not the only opportunity that we have to continue working on these issues from the governor's office perspective, and that we will be working in other areas to support behavioral health workforce development. So one of the initial projects that we've identified is what Sarah referenced as a talent assessment. So kind of looking at what our needs summary are, both collating the reports that we've had and recommendations from previous efforts, but also kind of creating we have an idea of, I hesitate to use the word dashboard, but supply. So look at supply across different, not beyond licensing and certifications, but also sort of in other roles that we know are integral to behavioral health workforce. We want to be able to look at current investments that we have in behavioral health workforce specifically and what outcomes we can anticipate for now, and looking at some of those more innovative investments we made during the pandemic to understand what really worked well and maybe what didn't, and or as well as we wanted it to, and what we would need to make investments or tweak those kinds of programs to benefit our organizations now. And then that will inform what we put it forward as the governor's budget package for the next biennium. We also want to look at vacancy and retention rates and recruitment and retention plans for the contractors of behavioral health services across the state. So we're looking at creating a baseline of current vacancy and retention rates for behavioral health providers that are serving Medicaid populations. So we're starting with that subset of populations to look at some of this to create kind of a baseline so that we can measure progress on some of our investments and programs. We also want to provide, and I heard some comments, I think, Heather, from you around creating support for organizations, not making it feel like we're monitoring as much as we're creating the baseline for the kind of TA or technical assistance or training series, best practice sharing, to provide retention and recruitment strategies that are more equity centered and also can be create some of the workforce changes that are needed to retain and recruit people that we're needed now. And then the last big project of the workforce initiative is around we're calling it improving customer service, but it's around looking at licensing boards and other certification programs and thinking about things through an efficiency lens. So how can we improve the way that we're engaged through the agencies that the state oversees in those regards? So that's kind of a high level of what we're hoping to, it's not hope, what we are beginning to embark on here in partnership with our agencies and direction. And as one key step, I just wanted to give a heads up to some folks who may receive this. We identified the top behavioral health service providers serving the largest numbers of Medicaid clients in the state and sent out a very brief survey to folks. So if you hear that there's a governor's office survey coming around, that's what that is. We sent it to only 18 organizations just to kind of get a snapshot of where things are at. And it was largely centered around that question of vacancy and retention rates and what innovative practices or if they benefited from state incentive programs that we've put out. So we're going to look at that and then convene a small conversation around some of those things. But we wanted to do that initially, even though we know that there's an effort that Future Ready is leading right now, engaging much larger scale across the state. So I'm open to any questions or feedback if you have any now, but I don't know how much time you set aside for me, Sarah, so.
We have here, well, I lost a microphone. There were 3 and now there are 2. So I'm sorry for taking that from you. Oh,
No problem at all. So
plenty of time for questions for April. They've been super collaborative as we've been thinking about where the value add of the consortium is, but in particular around the survey, making sure that wasn't duplicative. And we were, of course, our industry focus groups are focused on the broader healthcare ecosystem, not just behavioral health. So, but they include behavioral health providers. Questions for April? Yep.
Sorry.
I appreciate that. You mentioned supply, current investments and the anticipated outcomes, the vacancy and retention rates, supporting organizations. What I didn't hear in there are a couple of things that I know when we were at the talent, we heard a lot of stories about people getting access, right, to, I think Becky mentioned something about, was that right? Well, what is it? But there's lots of people that have, and I'm one of those people that have, when I moved to Oregon from Idaho 2 years ago, and I worked in Eastern Oregon for a long time, but my child, who was 17 at the time, had a lot of trouble getting access to mental health, right? It took us 6 months to get a primary care physician for her to even prescribe meds. It took even longer to get a therapist and psychiatrist and all of that, right? So my question about this is, I didn't hear anything about looking at access to higher levels of care as needed. So I think that's a barrier that should be looked at. I also didn't hear anything about differences in geographic regions around the state, because I think that might be also affecting. And then I know there's one that probably a lot of people have, which is insurance and cost barriers and what insurance covers and things like that. I think and those are things that I think should be on that as well.
Absolutely. Let me just jot down what I think your questions are here. So I focus mainly on the workforce incentive programs that we want to put forward. I think what you're asking is also embedded in the capacity expansion for services in general. And so I didn't share some of those goals, but there are some kind of like parallel goals alongside expanding capacity. And there's also a youth initiative that is not couched here under the behavioral health initiative, but there's a behavioral health youth initiative package that we're building out as well that Rachel and we've been working kind of across with agencies with that. The SOCAC has been leading that and to be able to put that together as well. So those were not mentioned because that's not in my work plan.
Gotcha. Well,
but to be honest, they're very important parts of the spectrum. So I appreciate you bringing that up. And then I think you mentioned geography considerations. That's very important to the governor, that we are thinking about regional plans. And I've heard that in the comments today as well, around the kind of workforce that we need to be by and from communities that we're attempting to serve, both in demographics, but also in regions. And so I think as we are looking at recommendations of workforce capacity expansion, those are going to be important considerations of investment. And I think, part of the analysis, the talent assessment that we're tasking the tech with leading is looking at all these recommendations, and then ideally we're diving into the regions around their specific needs. So we're not just creating blanket investments that may not work for areas that don't have the same kind of infrastructure. And then insurance, yes, we are working initially with the Medicaid population, but our relationships and roles with our local CCOs and Medicaid in general is an integral partner on looking at all those pieces too.
Okay, thank you. I appreciate it. I just wanted to mention those things because if the assessment is occurring and we're thinking about what questions are going to inform the assessment, what overarching questions. There was one thing that I forgot to mention, and this is also a personal thing for me. You have no idea how many times I filled out a release of information so that they could share my daughter's information between hospital systems, and nothing was ever shared. And that's really, really poor, because if we're talking about coordinating care amongst a bunch of different people, it doesn't work. And even if I filled them out and gave it to them and signed it and everything, they still didn't get the records from the other hospital systems or other providers or whomever, right? And so it is a fragmented system of misdiagnoses, undiagnoses. I don't know.
Yeah, appreciate, yeah. Thank you. Well, I was just gonna say, like, this is behavioral health, I know. Can folks hear me? This is not as speaker as the other one. But just want to make sure we're keeping our comments and questions around the workforce. And I know that Behavioral health is a big system with lots of different levers, and just asked April to speak to the workforce stuff. But your comments around the geographies and the making sure we're exploring the right questions in the assessment, but just wanted to name and engage in reality. I know Becky did share at the Talents Summit some personal comments too, just around we're all experiencing the healthcare system, and I don't want to lose that sight of that here. We all experience it as people, and we're moving through it. And I know that I've experienced some of those same challenges. So not to deflect or not engage the reality of the comment, but just want to make sure in this space we're lifting up some of the workforce components. Sorry, I did not mean to speak for you, April.
Oh, I did have
Did you have?
Oh, no, I appreciate that framing. And it's all part of it's all pieces of the initiative package. So pulling out workforce, I mean, it's also for people who work in healthcare, if they're not able to help seamlessly the people they're serving, that is part of the strain that they're experiencing as workers, right? So I think it's all connected anyway, and definitely part of some of the modernization efforts that we want to put forward through this next budget cycle. I've seen things, like the state hospital moving to different records systems that would help make those referrals more streamlined, for example. So there's definitely some momentum there for getting the ability to share records across different programs and settings that would increase efficiency in referrals and then increase the capacity. We're couching that under capacity effort because it would make better use of our existing capacity. But sorry, Sarah, to go on.
You're fine. It's real. My
Just not sounding like just repetition. I think the employer conversation that the employer engagement is a big deal in the behavioral health. Back to his comment, because one of the biggest barriers to behavioral health is cost and accessibility. And so even if we do build this pipeline, the cost piece, which ties to insurance benefits, the accessibility, which ties to a network inadequacy, and the geographies, they all go hand in hand. So just I think would be key to get those conversations in the number 3 priority.
It was a slow microphone to get up and running whenever you turn it off, but I appreciate that. I think it makes the healthcare consortia's work a little unique and different from, say, semiconductors or manufacturing, is that we really need to be aligned with health policy and health policy goals. And it just only emphasizes that we can't have the workforce conversation separately. They're connected. And we just need to continue to reinforce and align with that. Heather.
Hi. Heather. This question might be a little micro, and I don't know if we'll have a chance to talk in breakout sessions or not with you, but I'm really interested in those surveys that went out to the 18 largest behavioral health providers that provide Medicaid services. When did those go out, and do you have any results back yet? And do you need help getting those answers back?
They went out Monday or Friday and Monday.
Okay.
And I don't know is the answer on the results. I will ask my admin if where we're at with that, and if I can get an answer before breakout, I'll let you know.
Yeah, we've been happy to hype those, and if any of them are our members, which
We actually talked to Heather about it before it went out to get some contact information to make sure, but we may need some help with the nudging and the reminding. And I think, and again, I don't want to take away from the consortium's engagement sessions as well. This is really the governor just wanting to have a snapshot quickly of what's maybe working and what's really not.
I think it goes to that data piece that it goes to the assessment, like if the data is going to be shared.
I was just saying,
hear you online.
if the data is going to be shared from those, I don't know if they plan on sharing it or not, but it would be worth it for knowing where we are in a snapshot, like you said, for designing this assessment, I suppose. We have not talked about what we're gonna do with it. It's just an initial internal assessment and then, I think it would be helpful to maybe discuss with our OHA and tech partners around what's our next steps for engagement and research from there.
Great, and I think that as collaborating, we don't see it as duplicative at all, just like continuing to add value to each other's work. And I just think in the workforce area right now, the more we can amplify each other's work and add value, I don't see it as and our focus groups are including both behavioral health, long-term care, direct care, employers. So the conversation is going to be a little broader around demand planning and looking to the future, not asking the specific vacancy questions, but certainly we can continue to collaborate on the results as they come from our employer focus groups. Other questions before Jennifer and I the update on 2 relevant policy option packages? Wonderful. And I'm going to try to not. I am so sorry to the folks online. If you have had an echo from me all morning, afternoon. All right, so I'm going to tee this conversation up really quickly, but at our last meeting in April, you heard from Kyle Thomas, who is the HEC's legislative director. I think I got his title right, to just do a very baseline of like, what is the process, and a reminder that this group is advisory to the Workforce and Talent Development Board and the HEC. So what does that mean and what does that look like? And we shared a little more about the HEC's budget and policy process. We're going to just 2 slides. Jennifer's going to remind you of that. Talk a little bit about direction we've received from the governor's office that has guided some policy option packages, and we're going to give you an update on both of those policy option packages today, and then we'll go into some breakout sessions to discuss them. Jennifer. So my colleague Jennifer Purcell, who's the director of Future Ready Oregon, will do the first update.
Is this the hot mic? This is the hot mic. All right. So we thought we'd do just a quick review of, I feel like I need to be behind the podium where I can see you. Quick overview of some of the highlights that you heard last time you convened, but then getting into more specifics that we have received since you met last, because as you can imagine, the budget and policy process is rapidly evolving. So first, a little bit about timeline. Kyle shared with you the process about developing policy ideas, budget priorities, program priorities. That conceptualization phase sort of happens ongoing, and I really like to think about that engagement happening with boards, commissions, advisory committees like the Industry Consortia on an ongoing basis, always informing what the priorities are, what the programmatic or project implementation priorities should be. Also in this conceptualization phase, which is probably where we were the last time you met and when Kyle presented, that's about the time that we get budget instructions as an agency, and we begin as an agency to develop priority problem statements, think about possible solutions, and then get direction from the governor's office about partner engagement, specifically on legislative concepts and policy option packages, which are the budget components of our work. The drafting process, which happens typically in the spring, April through July, is when agencies start to determine whether a proposed solution to a problem is a policy solution or a budget solution. And you all have done some of that in your early forming work around, okay, what are some of the problems that we hope to solve, and do those require a policy solution, or do they require additional funding, or sometimes both? So the HEC has been doing that work and then beginning the work of partner engagement. Additionally, we better understand what the cost of our current service level is. And I think Kyle talked with you a little bit about current service level, but essentially to do the same thing that we're doing now, what will that cost us in 25, 27? So that's the current service level. And then we are in the process of drafting policy option packages and legislative concepts that will be submitted to the governor during this phase where we are squarely right now. But we are rapidly moving into the finalization process, which is where budget and legislative concept narratives are fully developed. And our budget is due to the governor's office by September 1st. So we expect that the commission will be adopting our 25-27 agency request budget at their August meeting. And then we move into the decision-making phase. And at this step in the process, this is after the agency request budgets have been submitted to the governor's office, and the governor is developing her recommended budget, which will be released in December, if I remember correctly. Okay, next slide, please. So a little bit about the 2024 specifics. These we did not have at the time of your last meeting, so we wanted to make sure you have this information. Most importantly, the HEC received direction from the governor earlier this year that for the 25-27 biennial budget, our agency request budget is limited to 1% above the current service level. So remember that current service level budget, or CSL, is essentially what it will cost the agency to provide existing services in 25-27. And then our proposals for new work are limited to 1% over that. With some see here, the university and college support funds are an exception to that cap process, and potentially some other items. You'll see in 2024, there is a continuing focus on the governor's priorities as we heard earlier, housing, behavioral health, and education. And then, as we mentioned, partner engagement. Socializing some of those concepts has been happening throughout the month of June. And then I think the next slide goes to Future Ready Oregon specifically. So we've been working closely with the governor's office to explore what an additional investment in Future Ready Oregon might include. And our proposal included both the budget and the policy pieces that we talked about. I think about it in 3 buckets. First, it's important to note that the Future Ready Oregon federal funds, the American Rescue Plan Act funds that were appropriated in 2022 with the initial bill, those all must be obligated by the end of this calendar year. So by December 2024, all of that funding and then we have until 2026 to spend those funds. So as we're awarding this final round of funding opportunities, that project implementation will happen over the next 2 years. The balance of those funds, though, that haven't been spent by June 30th of 2025 have to be reauthorized as part of HEC's budget. So this would be an example of an exception to the cap, which is the reauthorization of the ARPA funding. We've estimated we'll have about 62.5 million that will be already obligated but not yet spent. The second portion of our proposal was seeking a new state investment. This would have been a general fund investment to continue the work of Future Ready Oregon through the 25-27 biennium and into the future. And then the third bucket is incorporating some of the lessons learned from Future Ready Oregon implementation into some statutory amendments. We understand at this point that the HECS agency request budget will include the ARPA reauthorization, and we will be pursuing the statutory amendments with a focus on integrating best practices from Future Ready Oregon, and aligning the Future Ready Oregon statutes with other HEC workforce development statutes, with the goal of contributing to a more unified, equitable, and accessible workforce system, building those lessons learned into some statutory amendments. At this time, we understand that the agency request budget will not include a new investment in Future Ready Oregon. So the general fund investment of 75 million has been proposed, but we understand that will not be included in HEC's agency request budget. It's important to note that project implementation, as I mentioned, will continue through 2026. And our work will continue to inform strategies for equitable access and success in post-secondary education and training. And as you have, I think it's your fourth pillar, your priority number 4, am I remembering them correctly? Continue to learn from the Future Ready Oregon investments, the programs, the projects that are being implemented, identifying themes, and again, incorporating some of those into statutory changes in 25, 27. I also think it's important to note that the industry consortia itself was established in statute in 2022 when the original Future Ready Oregon bill passed, and has subsequently been built into HEC's current service level budget. So the industry consortia, healthcare, manufacturing, and technology, are permanent advisory bodies to the Workforce and Talent Development Board and the Higher Education Coordinating Commission. So your work will continue, and it's just important to make sure that you all understand that it's not tied to a new investment. I think those are my slides, but I'm happy to answer questions if you want me to do that now, or do you want me to wait?
Let me think about that. Yeah, maybe we have questions for Jennifer now, and then I'm going to go through the behavioral health, but we can also go through the behavioral health stuff and then ask questions at the end. This is bright light.
I'll just sit.
Did anyone have any burning questions for Jennifer? Dave has some burning questions.
75 million of the new state investment, is that over the next biennium?
I'm going to repeat the question so the folks online can hear it. It's okay. Does this, just repeat.
The new investment that the state would seek of 75 million, is that over the next biennium?
You're gonna have to run the microphone back to me.
We have so many. There's so many next. I'm just gonna get another microphone.
Okay. So Dave, first to answer your question, the proposal for the 75 million was to continue investments in the prosperity programs, which are the regional investments through the local workforce boards. There was a proposal for youth programming, and then the workforce ready grants that focus statewide on healthcare, manufacturing, and technology. But just to reiterate, at this time, that new investment will not be included in HEC's agency request budget.
Great. Oh,
I'm
right.
sorry.
Fine. I've got microphones everywhere.
Do we have a reason why?
Thank you, because I was feeling green.
Yeah. 75.
I cannot speak to the why, but I can say that it was not approved as an exception to the 1% current service level budget cap.
So went into DAS, and that came back from Governor DAS?
Governor and CFO, yes.
Got it.
Yes.
Okay.
Yeah.
This is why we did the level set on the process in the last meeting, and just appreciate the questions. Don't feel green when you're asking them good questions. Okay.
Sit.
Yes. Great. So
Can I have the other one? You want this one?
The good one.
Yeah, this is so much better. So, I'm going to move away from the ARB 1% process, and April's here to also answer any questions about this part of the budget process. But at April's request, the HEC put together a behavioral health workforce policy option package, and I'm going to go through the high level detail about what that is, includes, and it's still in process. So this is the first time that we're having engagement on this. And I want to also share that part of the talent assessment is just to also inform this as it's in development. So the HEC is proposing a behavioral health workforce investment of $50 million in our behavioral health workforce system. And there's a three-pronged strategy here, and I want to name and mention that this builds from the work that the Oregon Health Authority did with their healthcare needs assessment. These strategies are called out explicitly in the healthcare needs assessment. It also builds from existing data about occupations that are needed. But as we went through the process, we identified the need for better data, better integration of supply and demand data. And I'll go into what we're doing immediately, which we heard about before, and some details in the POP about long-term. But just wanted to name that we really leveraged a lot of the work that OHA did with their healthcare workforce committee and putting together the needs assessment and the identified strategies. So the first strategy, you can expand, or go to the next slide. Strategy 1 is expanding education and training pathways to improve the supply and the distribution of our behavioral health workforce. And we envision this as grants for public universities, community colleges, in particular to hire faculty needed to meet accreditor required ratios and expand programs for high need credentials and critical shortage occupations. I'm naming 2 here, but some of the talent assessment is going to uncover some of this. Certified addiction counselors, qualified mental health professionals, and other licensed providers. And these grants are intended to strengthen alignment and transfer pathways between universities, community colleges, and expand credit for prior learning assessment capacity in these programs. And then behavioral health workforce ready grants. So like the workforce ready grants, learning from Future Ready Oregon, really thinking about competitive grants for community-based organizations, private universities, local workforce development boards, and other allied education partners, thinking really about those entry and mid-level non-licensed occupations, but also stackable credentials into licensed occupations. Strategy 2, increasing the diversity of the behavioral health workforce by offering scholarships for new and existing students. So when we were looking at kind of the investment, prior investments, a lot of the incentive programs were built around existing workers. So folks that already have a licensed credential and incentivizing those folks to stay in the workforce and work at whether it's a Medicaid provider or other high need area. And notice there a need for scholarships for new students. So recruiting new students, in particular diverse students, into the education and training pathway. So scholarships for, in particular, strategically investing in priority populations outlined in Future Ready Oregon, leveraging the learnings there, and encouraging potential students to enter, and thinking about, as we were putting this together, the HEC writ large as this consortia, and as we're thinking about sector-specific strategies at the HEC, thinking about leveraging the HEC writ large. So we have an Office of Student Access and Completion that has run a really successful teacher scholars training program to recruit diverse teachers into the education workforce. So leveraging some of the learnings from that program for the behavioral health workforce. And additional scholarships and subsidies to encourage existing students to enter behavioral health graduate career pathways in particular. Next slide. And then the third strategy is improving supply and demand data collection to promote data-informed strategies for the behavioral health workforce. So I'm adding the bullet here as we decided that we could do the behavioral health talent assessment just now without it being included in the pod, just leveraging existing resources that the HEC has under the industry consortia to conduct this assessment, but thinking about the great work of the Oregon Longitudinal Data Collaborative and the nursing study that they conducted took, I think, over 2 years of work and data collection. And while we think that's the gold standard of using longitudinal data and really identifying systemic barriers in our education and training system, thinking how we might learn from that and include that capacity for the behavioral health workforce. So before we go to breakout groups, I am going to entertain questions. I want to remind everyone that this is the first step in an engagement process, and we're working with April and their team and OHA to really refine the components of this POP for the next several months, and can have April answer a question specific to what that looks like and how they envision the consortia to engage in that process. But wanted to, one, let you know that we did develop this as part of requests from the governor's office, and we are moving ahead with the behavioral health talent assessment immediately.
And Sarah, I might just add one thing. So just so that there's clarity about process, as we looked at that initial, the blocks and the arrow and the timeline, agencies are developing their agency request budgets over time, and then those are submitted to the governor in September. Governor is developing her recommended budget. Initiatives can find themselves in either place. And so when I was talking about the new investment in Future Ready Oregon, not being in the agency request budget, it's just important to note that the agency request budgets are one step in a complex process. And in contrast, the behavioral health POP that Sarah's talking about is something that's being developed as part of and in response to a governor's initiative, which will be represented in the governor's recommended budget, separate from the agency request budgets.
Thank you for clarifying.
Yes.
Can I add just one tiny thing? Yeah, thank you for the clarification. And I would include that this is not comprehensive of everything we asked for under behavioral health workforce. There's also requests for on OHA side for investment as well. So we'll be looking at those things together as complementary, and we asked the HEC and OHA to work together on a complementary package for our consideration. So we want to make sure that those roles are clear and the lanes are clear for where those programs should live as well. So if you're looking at this and it feels one-sided, there's another side not reflected in.
Thanks for clarifying that. And we're just speaking to the HEC. Yeah.
I know we're on. Yes, thank you. Thank you, Melissa.
Oh, I didn't know about this. I tried to.
There you go. Thank you. I was going to ask a question about the breakout groups, because I kind of feel that we did this discussion in the, are we going to have a different discussion in the report? Because we had all the time at the beginning. I just want to make sure I understand, because we discussed the priorities and we had the back and forth on that. Are we having a different discussion?
Yeah, well, I think that's a great question. And so how I envision the breakout groups is, one, we did have the discussion on the priorities, so I don't think that we need to redo that discussion in breakout sessions. The breakout sessions, you started to have your own kind of policy priority discussions at the last April meeting. So not the HEC's policy priorities, but your own organizational priorities of like, what are you thinking about for 25, 27 healthcare workforce investments? And so I'm hopeful that you can kind of have that ongoing discussion and reflect on these two policy action packages too, and any feedback that you have regarding these two policy action packages. Does that clarify, Dr. Bennings?
Well, can we, just a suggestion,
Thank you, Melissa. Can we do this part as a full
Yeah.
group?
We don't have to go. I'm responding to everyone saying, Sarah, I love the breakout sessions. Please keep doing them. So
Maybe that was just
I'm open.
If anyone's opposed, by all means, I just want to put that out there. I just believe, in my opinion, that we could have a large, use this time to
Love it.
have a large discussion.
Yeah, I think that's a great
Okay.
option. I love changing agendas.
Thank you for your
And
flexibility.
yeah, love it. So I'm open to just having that discussion now, and we can, depending on how long, we can still hold ourselves accountable to the 4 p.m. close, but we can also go to 4:30. But I don't need to even, we could just have this discussion now. We don't just go on the board. I'm curious if there's any comment or feedback. Melissa, you have something. You have a microphone.
I don't.
Oh, I thought you had your hand raised.
Oh, I was just thinking that maybe that next slide would be helpful
Oh,
to
yeah.
help us think about the discussion overall.
Yep.
And are the two different pops both about behavior? I just want to make sure I was tracking appropriately. They're both about behavioral health, right? Like you said, the two different, no.
That's why I don't think that is helpful. So the two, oops, now we're at the, it's fine. So the two pops that we just went through, Melissa, one is a Future Ready Oregon pop.
That was a 75 million that didn't get into the budget. That was a 65 million, right?
Correct.
Okay.
And then the 62. And the 62.
And that is about that, just continuing the work of Future Ready
Correct.
Oregon into the next biennium. And then there was a behavioral health pop.
Correct. And
I
there's two
think.
different processes, and that's where I think it's important to name.
Yeah, of course.
Okay.
Yeah. I guess I just want to say to you, Sarah, and, to the governor's office, like, I think it's totally appropriate for the governor's office to ask for a pop and for you all to respond and write one. I think it's good. And I think that it means that she's looking to this group of folks for guidance on some of the work that she's trying to do around workforce. So I guess, that was one of the things that we were just saying is I think that some of that is just like, glad we did it. And now we'll see where it goes in the process. So just we'll add that. Like, I think that's a normal part of budgeting and policy making. And I think that sometimes our, committees playing critical roles, but sometimes it's just like, there's a priority, it's coming, and they'd like to be infused with the input of the people who are working with a bunch of people on the ground. So I'm glad that, because otherwise it could have just been written by the governor's office. So I actually think it's really positive that like they saw this group as a place to come and get that input.
Appreciate that, Melissa. And I think maybe responding, Melissa, to the two pops, as April mentioned, that OHA, like, this isn't the only behavioral health workforce effort underway. And we're coordinating with OHA to ensure that we're adding value to each other's policy options. Other questions, comments? And yes, I think that when I built the breakout groups, I didn't imagine such a robust discussion early on about all of the priorities. So I'm like, hey, we already had that discussion. We can have this discussion as a large group, and then I can share a little bit about next steps and wrap up. So do folks have we have someone online. Cheryl.
Yeah, this is terrific to hear about the HEC's proposal for a behavioral health workforce investment. And I guess I'm struck that there's a HEC workforce investment and the governor's office workforce investment. And I also sit on the House Bill 2235 work group where we're going to be making some recommendations around what sort of investment is needed for the behavioral health workforce. And I want to, there was a comment, I think, about there being complementary packages and recommendations. And just being a person that sits on some of these different groups, and I don't have visibility to all of it, I think there's a way for us to be better coordinated so that the right hand knows what the left is doing and that we're not kind of unknowingly making requests for money for the same things, and that we can be sophisticated about what we're requesting and not duplicating our efforts. And the other piece that I'll say is, you know, sitting on the House Bill 2235 work group. That is a group that is, the people who sit on that work group are behavioral health providers. People are representative and reflective of the diversity of Oregonians and the geography of Oregonians. They're people who are not policymakers. They're not professionals. They're people with lived experience. And they would be, I think, they want to be a part of the process. They're at the table to make a difference. That's why I'm at that table too. And I think they'd be kind of swimming and not understanding, oh, wait, the governor has, you know, this package and heck, what is heck? And so I think there's a big opportunity for us to align our efforts and for the right hand to know what the left is doing. Because there's a lot of like well-intentioned efforts here, but I do a ton of work around behavioral health workforce. And I just feel like I keep kind of turning over rocks. And it's really hard to track everything that's happening, even the really good stuff like this.
The delay, Cheryl, was just my microphone again, not turning on at the right time, but just I so appreciate that perspective, and know that April and I have been working really hard with in partnership with OHA, but just hearing you say that, it's like we can do a better job than communicating that in coordination to our external partners. So just want to name that. I appreciate that perspective as you're hearing us say we're coordinating, but then you say, well, how, and can you share the details? So that's just on us then, I think, for some accountability there. So thank you.
Yeah, thank you, Sarah. I want to also acknowledge how this is a little bit different of a process with these special initiatives being outside of the agency process. And I think we gave you about a week to develop something. So I want to give you credit for being able to do that in a quick time around. Similar with changing direction on OHA on a dime. And the direction was also for you all to work together with not much more support than that. So this comment is helping to identify pathways to collaborate deeper than at the policymaker level. And I always appreciate that opportunity, as does the governor. It's a priority for her for things to be informed by groups like this and people actually doing the work. So appreciate that comment, and I think it's a really important one. And I know that Sarah and I and Neelam and Tim Nesbitt, who's sitting on the House Bill 2235 group as well, have been in talks about how to convene regularly and share better collaboration. So it's definitely not an intention to leave that group out. I meet with them outside of the meetings weekly to share, to hear what feedback that group is providing, and then I meet with Sarah for that as well. And so that's a little bit of the role of of these initiatives to play that convener of the different efforts and identify where these different tables are and make sure that we're incorporating that feedback as well. So thank you for uplifting that.
Thanks, April. And I think that as I think Dr. Benning saying, like, can we just talk about this here? Part of the purpose of putting this even on the agenda is that I've heard a lot of y'all say, to what end? To what end is it to advise the HEC? To what end is it to advise the WTDB? And so just want to name that, to what end is it results in some of these policies? We're not just going off in my gray cube and developing something, but it's through intentional listening and engagement with experts in the space. So just wanted to name that. It's to what end as you're seeing that, and while it may, and it connects to the priorities that we've discussed. Elon.
I just wanted to echo what April was saying, that we are in communication and, we have regular coordination meetings and, we purposely delayed the release of our next how-to funding cycle because we knew Future Ready was planned to release. So we're planning for September release of our new request for grant proposals. And, I really appreciated seeing workforce needs assessment recommendations influencing this POP. We, are currently working on our new healthcare workforce needs assessment, which is due to the legislature by February 1st of 2025. And so really starting to think about how we can build on the last needs assessment and really what are best practice strategies that are being used throughout Oregon, but also nationally to really build a culturally responsive workforce, because it's going to take multiple different strategies. There's some short-term, some long-term, a whole mix of different it's going to take to really build the workforce.
Thanks. Someone told me the problem was 3D and that never resonated so much. Other comments, questions? Wow, we could exit like a whole hour earlier, which I'm sure everyone is very grateful for the time back, but don't want to rush us through anything. If we have comments both on the medium-term objectives, but also in where we're headed, but also these two relevant pieces of policy that we're actively engaged in. Great. Can you go a couple to the final slide? I just wanted to elevate that, as I mentioned in our charter, that we're going to be hosting one quarterly meeting, Consortia on the Road, and that quarterly meeting in September will be at Road Community College, and we're going to be organizing some site visits, some, I don't know, fun times. I guess, can I say that? Fun times. Whoever wants to join us in the Rogue Valley, and just thanks to Dave, who's going to help us coordinate that from Rogue Community College. But looking forward to sharing more detail about the exact location, timing, and all of that shortly. But please put that on your calendar. Plan for fun times. And I will see you all then if I don't talk to you sooner.